All right, so I want to go through the issues that can affect the manufacturing process when it comes to aseptic processing. So, perfect segue. Um, Talk to us about, Mike, what are the critical elements to successful aseptic processing?
So, we had talked before, and I talk about this a lot in the industry. If we look at the beginning, right, we take an apheresis or a tumor sample, we apply it to our culture. And aseptic processing guidelines say anything added to an aseptic process has to be sterile or able to be filtered to be sterile. Well, you can't filter a living cell. And contrary to what this I guess is now in my opinion, you cannot take an apheresis sterilely. It's not sterile by definition, because it's because taking that needle jab is just not sterile. But we treat it as aseptic and sterile, right? So beyond that, what I look at is any manipulation that can impact sterility has to be addressed. If we look at a typical TCA, I was involved with one process where we did a aseptic processing risk assessment. We looked at every place, every area in that process where we can get a contamination. This document was well over 500 pages. And one of the things we did, we look at tubing sets, reduce the number of manipulations tubing sets. So we started making custom tubing. And you could do one tubing set and it could reduce 25 pages of that risk assessment and make it easier. There were some, in the early days, we had operators modifying commercially available tubing sets to fit the process. That right there is a risk, an aseptic risk. So we really have to think about how we execute this. The challenge in cell therapy in general is it's very academic, and it working with CMOs that have a little more commercial experience or getting people from like my background in monoclonals can help us design these processes with these aseptic practices in mind. Now there are differences between jurisdictional differences between this. Although we are harmonized, I can tell you there are different countries have different concerns. But if we look at the process holistically from an aseptic perspective and use risk assessments and risk management methodology, then we can really target what the product needs to maintain sterility and safety. The other piece is our lot release. We talked about the need for rapidly providing these products to the patient in an autologous setting. This really has resulted in us exploring these rapid sterility techniques to be able to get a sterility readout as fast as possible. So an example, a challenge, I was talking to somebody at a very large monoclonal facility, and I asked this head of quality, how long does it take you to release a batch? Well, this also relates to allogeneic, I guess. Everybody, working on 6 to 8 weeks. Well, in autologous, we're talking about 6 to 8 days.
Mhm.
So how do you get to the point in an aseptic process where you could release a product purported to be sterile within 8 days of the last manipulation? And the only way you could do that is with rapid sterility. Developing rapid sterility is a challenge as well. So I look at it in terms of really two things. What are the analytics required to ensure sterility in process? That includes in process sampling, and then the manipulations that are required and those that can be removed from the process. So fewer manipulations means a safer product.